All right, good morning, everyone. Welcome to the Southside Wellness Coalition. I'm Keenan Tanner Smith. I'm the fiscal agent for the Southside Wellness Coalition. This morning, I'll go ahead and start, first of all, with sharing the minutes of the last meeting, and then we'll proceed to introductions, starting with those in the room and then those on the Zoom. All right, so last month, and by the way, also last month's recorded meeting is on our website, bewellsouthside.org, available to you on the blog, or if you receive the monthly newsletter, it was the first featured item. So everyone should see here that last month we had a hybrid meeting again. Those who'd like to come in person at 10 o'clock at the admin building or via Zoom. Members present there, there were a motion to approve the minutes. Again, those in person, if you'll scan the minutes now, and those online, if you'll look to see, I'm sharing the screen. Stephen spoke about Recover Fast, and we went through a number of different coalition business items. We are doing quite well with lots of good information. Oops, we got somebody coming in the waiting room there. Give me just a second. There we go. You have to shake their hands and get them in, right? We adjourned at 10:56, and today is, of course, November 17th, our next meeting. These minutes are also posted on the website as well. All right, and so I'm going to stop share, and I do need a motion to approve the minutes.
I motion to approve the minutes of the October 20th, 2022 meeting.
All right, thank you so much. All right, so I'm going to share screen on the agenda for today, and then we'll start with introductions. Today's agenda, here we go. All right, so today's November 17th, again, hybrid meeting for the coalition, and moving forward, we are already planning dates for 2023, which will be announced over the next couple of weeks. Next meeting will be December 15th, also will be hybrid. Today, we are going to focus on talking about CADCA, the national forum that occurs at the end of January, and the opportunity that we have to send 2 to 3 folks to that gathering, and then also talk about the election of leadership team, which needs to take place in January. So I'm going to cover some of that. And as you can see there, we have a number of different coalition business items, what's been happening between last month and this month. And you can see I tagged a couple of members in there if they'd like to talk about some specific items.
I'm sorry, I just got an email from Marion. She needs a meeting link. Can you send her one?
Oh, okay. All right, let me see if I can do that. I'm gonna stop share screen on that. Let me see if I've got, let's see, go up to the meeting link, copy link. And 1 second, see if I can actually go to my email.
That may have been what your phone
You're
was
putting
doing.
me on quite the task there, Stephen, but let me try. Let's see.
I think that's what your phone was doing. She said she was trying to reach you.
Oh, okay. Well, I can't text it to her, so I'm going to tell her that I'm going to paste it right now.
I just told her you're
Oops, which
saying.
I just did. Hold on a second.
Right in the middle of your name, right?
I know. Yeah, you don't think that's being recorded, right?
I'm sure it is.
Yeah.
Can't see anything.
Oh, good. I didn't think so. I shrunk them down.
Daphne wants in
Oh,
too.
yes, we have more people coming in. All right, fantastic. That's why it's always good to do the review of the minutes first before we start introductions. All right, tell Mary I think I successfully sent it to her without crashing the Zoom. All right, awesome. All right, so let's go ahead and start with introductions in the room. And then we do have people rolling in on the Zoom, so we'll do them second. Again, those of you coming in, you should have acknowledged that you are being recorded for our monthly meeting documentation. All right, with that being said.
I'll go first, I guess. Hi, I'm Catherine Maloney. I'm with Tri-County Community Action Agency. I'm their CFO, and I'm also on the leadership team here on the coalition. Glad to have y'all.
Hi, I'm Stephen Wilson, also a member of the leadership team for the coalition. I represent myself as just a community member. I live in Mecklenburg County and glad to be here today.
All right, so I'm just going to start on the screen where I see folks that are coming in on the Zoom. So I'll start with who is to my left, and that is Christy Mosley.
Hi. Hi, good morning, everybody. I'm Christy Mosley. Glenn, I am VCU CMH practice manager for our behavioral health outpatient office here in South Hill. And I appreciate being here and glad to be part of the coalition. Thank you.
Thank you, thank you, thank you. All right, and then on my screen, I have Tara Rogers.
Good morning, everyone. My name is Tara Rogers. I am a community health worker for Virginia Department of Health. I cover Mecklenburg, Halifax, and Brunswick, so we have that in common with the coalition. And just thank you for being here today. My coworker is also on as well.
Awesome, who is that? So we can let them introduce themselves next.
Barbara Johnson.
All right, Barbara, if you please introduce yourself.
Hi, I'm Barbara Johnson, and I'm a community health worker. As Tara said, we both serve Halifax, Mecklenburg, and Brunswick County. And this is my first community health first meeting with the Wellness Coalition, and I just wanted to come participate just to see what it was all about. And also, we are always looking for resources that we can refer people to in the community, and I'm glad to be here also. And I know Catherine, she used to be my yoga instructor at the Y. Hi, Catherine.
Hello. Welcome, welcome, Barbara. Glad you can join us. You and Tara.
Thank you.
As well. Thank you. All right, then I'm going to move to Adam Anderson.
Good morning. My name is Adam Anderson. I'm a special education teacher at the Hughes Center in South Boston.
All right. Thank you, thank you. Welcome, welcome. And then Rachel.
Hey, yes, I'm Miss Burchett. I'm also a special education teacher here at the Hughes Center in South Boston.
Awesome. Good morning. Thank you. All right. Sorry for the delay. I'm just checking off my minutes. All right. Then we'll follow that up with Daphne. All right. We'll come back. Kimberly.
Hi, my name is Kimberly Throckmorton. I'm the manager of the Center of Nursing Excellence at the Southern Virginia Higher Education Center in South Boston, Virginia.
All right, welcome, welcome. Thanks for joining us. And then I see Andy, good morning.
Hey, good morning, everybody. Andy Strader with Optima Health. I work with our Medicaid managed care population as well as Medicare Advantage and DSNP. Good to be here.
All right, good morning. And Mary Crowder.
Good morning. I'm Mary Crowder. I am on the executive board for the Wellness Coalition, and I am working with the ticking that we are starting. I work as a program analyst for a company that builds behavioral health care networks called Blaze Advisors. Glad to be here. Glad to see so many folks here today.
Yes, good morning. Welcome, welcome. All right, and we'll go back to Daphne.
Yeah, good morning. My name is Daphne McDougall, Director of Education for the Hughes Educational Center here in South Boston, Virginia.
All right, good morning, good morning. All right, just checking my, should I get everybody? All right, awesome. All right, so let's go back to our agenda. All right, starting there. Okay, so first of all, what we do have are two really important items on the agenda this morning that need to be addressed between today and the next meeting. And that is a look at the CADCA forum that takes place in late January to early February. And I'm going to bring up that website here in just a minute and talk about that. Our funders have suggested that we send 2 to 3 people to that event that takes place because it helps us learn more about being involved in coalitions from around the nation and looking for ways in which we can bring youth on board as well, because they do have youth teams that also attend this event. So I'm going to share that. And then I'm going to go into the election of the leadership team. Believe it or not, it has been a year and we are to the point where we have to have a January meeting. And so during the months of November and December, we need to ask folks to step forward and be a part of the leadership team, and provided that they are nominated, or you can nominate yourself and you get second. I take care of all that on the back end over the course of the next 2 months, and then prepare us for a Survey Monkey voting in January. So let's start with that first. All right, so let me bring up the CADCA. All right, so again, CADCA is the leadership forum that takes place for all national substance abuse prevention coalitions. The event is in National Harbor, Maryland. Registration, as you can see there, as being the fiscal agent and managing funds for us, obviously interested in trying to get that early bird special that you all see on the screen. So if you feel you're in a place to be able to travel to National Harbor, Maryland, up in the Northern Virginia, DC area and attend this event, let me give you some particulars on it. As a coalition, we will fund the accommodations. We will also reimburse for meals. Your in-kind donation would be your travel with the use of your vehicle. The event runs 4 days from January 30th to February 2nd. And it covers the idea that you would go through training, have downtime, and also have the ability to travel to Capitol Hill if you so choose to do that. Stephen, I'm going to put him on the spot. Stephen has traveled to CADCA. So if you don't mind, Stephen, if you could talk to them a little bit about the value of this 4-day experience up at National Harbor.
Sure. I participated in 2 of these. The first one was via Zoom. It was remote due to COVID, but last year I did attend in person, and it's an impressive setup. It really is, and they're very accommodating. Everybody's willing to help you because the message that they're putting out there is so important, and they stick to that. During a time there are of course opening speakers, plenary speakers. There is a Capitol Hill Day where you have an opportunity to speak with your representative, but for me personally, my favorite thing about the entire thing is the trainings that they put on, and they'll do 2 to 3 per day while you're there in general. And in each one of those blocks, there will be anywhere from maybe 5 to 8 or 9 different topics. And you can choose what most applies to you, what you think you're there for. If you're in nursing, there are things for that. If you're in law enforcement, there are things for that. If you're a member of a coalition, there are things for that. If you're looking at information on opioids, then certainly that's covered. And you get to choose what you're going to go to. You don't have to sign up for it. You just go to the room that has the ones that you're interested in, or we will get a listing of what these are before you go. If your work or the coalition has something in particular they would like to get information on. You can choose that well in advance and know what you're going to be there for. It's a great time, and it really does get you fired up to go back and do the good work that we're all attempting to do. I highly recommend it. And I'm hopeful to go this year. I like to bring things back to the coalition from this. Having been, though, if we have people that can go, that are active with us, I'd certainly give up a spot so that somebody else gets to see it.
All right, thank you. Thank you so much for
Point of
that.
clarification.
Yes,
We will pay for the conference fee also. correct?
yes, I'm sorry. Yeah, we
Okay,
will
yep, okay.
pay.
Just if somebody wanted to go, the only thing they'd be
Yes.
on the hook for is the
Right,
gas money to get there.
right. The only thing that we won't support is the vehicle that you travel in and right, the gas that you spend.
Okay.
We do cover the cost of parking on site. We do cover your fee to actually attend CATCA, which I think is around $600 or $700.
It's
And
around
then-
600 now.
Right,
Early
and-
bird,
yeah, it fluctuates, I think.
685, something.
And then you have to eat on site, or you can eat off site, so we cover the cost of meals. Unless, of course, there's a meal. If they provide a meal, but we kind of go through that. Sometimes they provide breakfast, sometimes they don't provide lunch.
Right.
But
Okay.
I think everybody that's been before can say, Keenan made sure that everything that they spent, that out of pocket for meals, we reimburse for that.
Excellent. Okay.
And then we're also going to pay for the hotel accommodations in the Gaylord Hotel, which I understand is very, very
It's
nice.
very nice.
Yeah, so that's the National Harbor, the large hotel right there featured at National Harbor, the Gaylord National Hotel. You'll stay in there. We would like to make the early bird because I know in previous years, there are other hotels around this resort site. And one time we did it up with someone in a different hotel, still walking distance, but it still wasn't being inside of the actual resort. So we try to push forward. Last year, we had everybody in the resort, which was super nice.
And what's the dates again from when? to when?
It starts,
January 30th.
you can arrive on Sunday, the 29th. It starts on Monday, the 30th. And then all the, again, your topics, your business meetings run from the 30th to February 2nd, which is a Thursday. And you can either travel home on Thursday or travel home Friday morning.
Okay.
So
And
it's, go ahead,
Sorry,
Tara.
I apologize. What are the dates for the early bird?
The early bird.
December 12th.
December 12th, thank you.
Okay, thank you.
Absolutely, absolutely. And so, yes, we would like to have people email me, call me, if you're interested or not, and we'd like to go ahead and form a team before December 12th so I can put in the funding request and get that moving on my end. All right, awesome. All right, awesome. All right, next item that we have to cover today is the leadership team. So let me again share screen. If you all, let's see, I'm going to bring up our website. As you all are aware, our bylaws are posted on our website. There we go. Share screen, our gorgeous website. Under the blog, we have posted copy of our bylaws that our team did a phenomenal job of revising during the height of COVID. Part of what is in here under leadership team is that we are to have elections every year. And that our leadership team, composed of myself along with other members, are up for a re-election of those spots after 2 consecutive years. And so right now, based on my notes, we have 4 leadership team slots that are going to open up. We have 4 members of the leadership team who have served 2 consecutive years. That is Ann Bishop, Diane Edmonds, Gavin Jordan, and Stephen Wilson. Those persons remaining on the leadership team are Mary Crowder, Christy Mosley, and Catherine Maloney. So again, what I need to let you know is by email or by phone call, I will be emailing you after this meeting to all active members of the coalition and supporters, asking you to nominate someone. Certainly you can nominate yourself. I will reach out to other members to get a second on that. And then I will reach back to you and let me share with you what I'll be doing is sending you a copy of what we call a candidate biography sheet. And I'm just sharing on the screen a sample from years past in no particular order. And again, I'm just going to scroll down. This is where you can see, recognize names of the current leadership team members, where folks basically just provide a short biography of who they are. So that, again, when we conduct the meetings, again, you see this hybrid situation. So I can email everybody that's an active member a copy of who is running for leadership team, give them a copy of your short biography, and then give everyone access to the Survey Monkey link in January. And again, what we'll be doing is the ballot, which I should have shared screen the ballot, shouldn't I? But anyway, so when you look at the ballot, it will tell you that there are 4 vacant seats. And then what you'll do on the Survey Monkey is elect 4 folks to be a part of the leadership team for 2023. And I hope that I described that in the painless manner as possible. It's quite an exciting time, but I just like to always be upfront with folks about how it works. And then of course, we'll announce the 4 new members to the leadership team in 2023. And again, they will serve a 2-year term. And as Stephen reminded me, if for some reason, someone on the leadership team, for whatever reason, we can't imagine what it would be, but for whatever reason, might want to step away, that we notify them that we don't have a special election for them. The position remains vacant, or we might decide to nominate someone temporarily to take their place. But that once you're on the leadership team, we do expect you to serve for 2 solid years until your term comes back up for re-election. All right.
Question,
So, any
Tina?
questions? Yes.
Yeah. People who are already on the leadership council, they go through the same process if they want to renew a term. Is this correct?
Yes.
Yes.
Okay,
Yes.
so there's no difference
Yes.
between if you're not on the leadership team or if you are. You do the
Correct.
same, through the same
That's right.
process.
Correct.
It's
Correct.
doubtful that other people might nominate you if you're already on the leadership team. So if you're interested, it
In
wouldn't hurt to
staying.
nominate yourself.
Right, yeah, if you're
Right,
interested in
right,
staying.
right. And I guess what I was just clarifying was the idea that I would not be asking Mary, Christy, or yourself if you were going to be in some way want to be stepping down.
You're
So
assuming
the
I'm
idea that,
staying.
yes, because
Yeah.
we're assuming when you
Well,
come on the
that-
board, you'll stay for 2 years. We're opening the slots of Ann, Diane, and Gavin, and Stephen for opportunities for other folks to step on board the team, or obviously return to the team. All right. And of course, you know, with working with a group such as this for good works, we want to give people the opportunity to allow others to lead, or if they are still enthusiastic about the movement, to stay on the board with us. All right, awesome. And then unfortunately, y'all can't kick me off, but you know, hey, so maybe someday.
Shannon, excuse me, it's Christy, but the 4 names, Ann, Diane, Gavin, Stephen, have
Yes.
any of them asked not to be reelected? You're referencing them, their seats, but is that what I'm understanding?
Yeah, they will their seats will automatically be open. Those 4 seats, let me say, not necessarily their seats, 4 seats are going to open up for nomination. Once those 4 seats open up and we have nominations for those 4 seats, yes, we will reelect for those 4 seats.
Okay, just making sure no one had asked to come off. You referenced that earlier.
No.
You
And
would
I
have
was
to
only,
be nominated again and enter the ballot.
right.
Thank
So
you.
they enter the same pool, right. And I was referencing about people contacting me about stepping away. That the way we rewrote our bylaws, we're only going to be asking people to step away every other year for only half of the team. So we don't have to do re-elections for 7 to 8 people every year. Well, I shouldn't include myself, for the 7 people every year.
Continuity thing.
Yes, right. We're trying to keep our leadership team a level of consistency. Great questions. And of course, this is the good work that was done behind the scenes during COVID of revamping of our bylaws to make them more amenable and
That was fun. wasn't it?
successful for folks.
Yes,
All right.
it was a fun
Yeah,
process.
It
we had a
was,
good
it
time,
was.
though.
And they're fantastic, and they're on the website. You guys check them out. You can download a hard copy. They look phenomenal. All right, so moving on to coalition business. Couple of items. First thing, since the last meeting, we were requested to host an ACES training in South Boston on November 12th. We were invited by A&M Family Services to host an ACEs training last Saturday, actually, at the TJM Community Center. And it was, Mary joined me there, who's on the meeting today. And we conducted a very successful ACEs training last weekend. Up and coming on December 14th, we've been invited back by A&M Family Services to again join them on December 14th for a Safe Talk. As you all know, that's a 3.5-hour in-person only suicide prevention class that we teach and sponsor to help people learn more about how to create suicide alertness for everyone and how to have the conversation and connect people to resources. Tonight, the Brunswick County Public Schools is having a family engagement day. It's tonight from 5 to 7. I did send a table and some staff there from our Children and Family Services Department to go and give out information about Southside Behavioral Health as well as the coalition. So if you live in Brunswick County or know someone who lives in Brunswick County, please let them know that if they haven't heard already, Brunswick County Public Schools is having a family engagement night tonight. And then just a quick shout out to Tri-County Community Action Agency. It's not in our business, but I am holding 2 closed trainings for them tomorrow. We're having a Safe Talk closed training for them tomorrow, as well as a Revive Opioid Overdose and naloxone training tomorrow for them on their Friday, for one of their PD days. Yep. So happy to say that, but I share that, but it's not posted because it's not an open training. And then next item is our Trauma Informed Community Network. Is meeting separately and of course also part of our group here today. As you see on the agenda, Mary Crowder is leading that for us, and their next meeting is November 21st at noon, which is this coming Monday at noon. Mary, did you want to talk a little bit about what's happening with the Trauma Informed Care Network for us?
Sure. So we are trying to just revive the Trauma Informed Care Network that we started last spring, and we had some time of inactivity, but we have met with a core group of leadership last week. We've discussed items to broaden our reach and involve more people. If you are aware of ACEs, you understand how they impact people who have suffered them for the rest of their lives. And so our mission as a Trauma Informed Care Network is to educate the public about ACEs and how it affects the brain and how it affects everything health-wise for people who have ACEs. And so we would love new members if you are interested and passionate about this. We need some more folks to join. I'm hoping some folks from the training Keenan did Saturday will join. So it was a good training. Okay, anything I forgot, Keenan?
Well, we're going to be working on our name, right? Because we can't take Southside.
Where is it?
It's going to be on Zoom on Monday, and I can send the link out to everybody. Noon on Monday via Zoom. We're going to be working on our bylaws, our infrastructure. The Ticken is at a really good location. It's a location of formation, getting excited about starting to develop some systems. And Mary, would you say what we have, a core 6 people coming to those meetings so far?
I think 5 or 6, yeah, so far. We need some representatives from Halifax. I'm hoping to expand in that area. We do have a couple of folks from Brunswick, a couple of folks from Mecklenburg. So.
All right, awesome. And we are in the works as a coalition, since we do support overall wellness. We are working with Alan Mosley, who runs our website and newsletter, to create a web landing page for the Ticken, obviously, so it can get some appearance and some information out to the public on social media and such, until such time that they're able to self-sustain. So it'll be one of the connected projects for us.
Thank Keenan. Mary, I don't have that on my calendar. Was there an invitation sent out for that? Is it hybrid or is it in person only on Monday?
No, it's on Zoom. I'm pretty sure I emailed you, but I'll email to you again,
Yeah,
Christine.
I don't have to.
Okay. Let me do
I'm
that.
usually pretty good at grabbing them. Doesn't mean I didn't overlook it, Keenan, for sure.
Oh, no worries. If you get as many emails as I get a day, trust me. Hold on, let me make some notes.
Okay, great. Yeah, I was a little surprised because I knew I didn't have anything Monday at that time, so.
Okay.
But I guess Steven said he didn't have it either.
Yeah. Mary, did I brain cramp on that? Did you get something from me?
So I think that we started with the group that had been coming to the meetings in the spring. So we reached out to those folks that had been regulars and asked them, you know, if they would be interested in working with us to move forward. So it was probably, I imagine it didn't get sent to the greater leadership team for Southside Wellness. I
Oh, you know
imagine
what?
it was sent to them. We would love to have you and we will definitely get you that link.
No, I will send everybody
you.
that link. I'll send leadership team and everybody on today's meeting. Absolutely. We need more, we need more feet in that initiative.
Mary Ann, you said you met last week?
It's been a couple weeks ago, like the 8th.
Okay, I didn't get anything for that either. I indicated I would be willing to help, but I haven't gotten any information on anything.
All
You
right.
did, and I feel like I sent you something right after our meeting and didn't hear back from you, and maybe I didn't follow up by putting you on this list. So I apologize for that.
No worries.
Yeah, yeah.
I'll see you Monday.
Yeah, I appreciate the distro, adding to your distro list. And Keenan, did you say brain cramp?
I had a brain cramp, yeah.
I never heard that before.
Oh, sorry. I say that all the time. All right, hold on. I'm just making sure I'm writing down. Okay. All right. Awesome. All right. Well, they'll have more people joining our It is going to be, let me say, it's going to be a Zoom meeting. I'll send you the Zoom link. It is November 21st, Monday. It will be from noon to 1. I'll send everybody that Zoom link this afternoon. Not a problem. Awesome. Thank you all so much. All right, then we move to a couple of ongoing topics. Again, you know, we meet every month to talk about what we're doing from one meeting to the next. As you know, we continue to support the Behavioral Health Equities Grant that Southside Behavioral Health won in prevention to create some supportive structures for the LGBTQIA population in our community. As I shared last month, there was the recording of a PSA by local youth in our community in South Hill in October. That PSA is going to go out to the community at some point, most likely late December-ish. A press release will go out as well about it. And there's going to be a landing page that will be featured as part of the PSA that will come back. The landing page is called We Stand Together. It's a campaign created with Southside Behavioral Health along with some partners in the community, the Lean In Project, which is an LGBTQ nonprofit supporting the folks in the area who identify. That is going to be coming out. Also, as part of that, on the agenda, you can see I have outreach to schools. We have been invited a couple of times here and there to come and talk to the school leaderships about what we can offer as a coalition, what ways we can be more impactful in the schools. As you can see, I have listed there notifying them that we can offer to their staff as well as to their parents, mental health first aid, suicide prevention classes. We are also requesting they could provide a space in their school for LGBTQIA students to have a meeting space. We're also letting them know that we're trying to get many more youth involved in our tobacco prevention grant with the Virginia Foundation for Healthy Youth. And to tag onto that, part of the plan of that tobacco prevention grant, we are going to also be developing some PSAs. And of course, PSAs are short videos where young folks get to talk about why they do not use nicotine. Again, the idea of trying to let folks know that smoking tobacco and such and partaking doesn't have to be the norm per se. So we are going to be looking in January, February, reaching back out using organized marketing as our connection in South Hill, that are the folks that run this grant for us on social media, looking to recruit young people who would like to be featured in a PSA about youth tobacco prevention. So if you happen to know any young person, please send them my way. I'll put them in touch with the organized marketing team. That is an initiative we'll be working on in the spring, January, February timeframe, and then get those PSAs launched, I would guess, by April, May. That's some good stuff going on. All right. Any questions about that, about outreach to the schools? All right, and then the next one on there is I was contacted by Tamika Tony. She is a new community support outreach person. Or I should say that she's not new. She's been working for the Veterans Administration for many years, but she's now in a position where she has been tasked, as you can see I have on the agenda, with creating veteran suicide prevention coalitions around the state. So I talked to her in the last few days, and she is going to be, I invited her to be a guest speaker, which she has accepted. So she is going to be our guest speaker at our next coalition meeting on December 15th. She's going to join us via Zoom if I can't convince her to come have cake with me in person. Either way, she's going to be speaking to us on December 15th, and she's going to talk about, my understanding, just briefly, because I'm going to let her do her presentation. My understanding is she's going to talk about the Veterans Administration is making a statewide effort to allow folks who are working in suicide prevention, which we are doing, to talk about how to better connect to our local veterans. So of course, in hearing that, I said, absolutely, please come talk to our coalition members, please come talk to our leadership team. I would imagine this would be something we would be very much interested in being a part of. And of course, shared with her that we already currently have a wellness coalition in this 3-county area, but certainly incorporating a target on veterans and their well-being would certainly be something we would most likely support. So she's going to be coming as guest speaker on December 15th to tell us about what the Veterans Administration is currently doing and would like us to do in our local community. So I'm super excited about that. Super excited that she's going to join us. All right. Any questions about that? All right. And then Christy, you had sent me information about the Premier Cares Award. Did you want to talk for a minute about that?
The Premier Cares Award. What? Where is that at? Tell me what I did.
There is a grant or some type of funding.
Oh, yes. Sorry, that came sitting there like, what did I do? Hang on, and I wasn't prepared for that, so let me look that up, Keenan. That came to us, and what happened was you had asked me to check about us having an MD, I think, to kind of sponsor this piece. So I don't have a roundup for that. I'm sorry, I have to find that. I'm not prepared. Caught me off guard.
Oh,
But this
sorry.
was something that came to CMH Hospital, and they asked me to send that to you. So if I could get with you offline about that, and then we can circle back if you don't mind.
Sure, absolutely.
Thank you.
Absolutely. All right, and the last item we have for today, Stephen, you had sent me an article about Delta 8 THC. Did you want to talk about that for a minute?
Kind of like Christy, I wasn't really prepared for that one, but I can tell you that.
Did you guys read the agenda?
No, I didn't.
Oh, we'll take that out of the recording. That's cute though.
I'm gonna be honest. I was out for a couple of weeks on leave with a sick child, so I'm still
Oh, no,
catching
no,
up.
I know. I'm not throwing any shade. You know me, I just like to joke around.
I got thick skin.
That all
That's
started
okay.
because I sent Keenan an article about approximately at least 7 students at a Fairfax County school becoming sick from eating Delta 8 CBD gummies. And if you don't know what Delta 8 is, it's a cannabinoid. There's probably over 100 of those distinct cannabinoids in the cannabis plant, but It is psychoactive. It's in low concentrations in the plant, but when you get into these gummies, it's been concentrated. And what happened was somehow they got hold of the gummies. They are not federally regulated at this point. Some states do have laws concerning them. But for the most part, these things can be bought in convenience stores. But it did make them sick. They were vomiting. They were, there's the actual article that I sent. Just to make you aware that this stuff is out there. Kids can get hold of it. It is not without consequence if they do. You know, they don't know what they're doing. They're eating a bunch of these gummies. They look and taste like candy. And in this case, I don't think that they did it accidentally, but what happened is they kind of got in over their heads. And because they're not regulated, you have no idea how much of this stuff is in it either. You hear all the time about the actual dabs and everything else that you get out there that are 98, 99% THC. This isn't in that range, and it's not it's not as immediately dangerous, but it is dangerous. You don't know how many they're going to eat. You don't know what the concentration is that you're getting. To make you aware, this stuff is out there. And that's, I just sent Keenan the article because it caught my eye immediately when I saw it. But anyway, that's all I got on it.
All right. Hey, well, you guys sent me something. I take it seriously. I'm like, we can add that as part of the discussion.
And I do have a tidbit of information, but I'll need to, I just had to go back and refresh my mind on that, Keenan, if I've got just a second. But the hospital receives this and it is focused on the hospitals. I wish I could share my screen or something with you.
I can let you do that. Hold on, I can
Let me find a better copy of it real quick though. I think it's something that everybody on here may be interested in looking at. I mean, it's a lot of money, and it's been going since 1991. And it says you have to be loosely affiliated, Keenan, is what I saw on that piece. So anyway, I am happy to send this to everybody. Let me get back over to Zoom. Let me see if I can share my screen.
Made you co-host, so you should be able to share.
Here it is. Can everyone see this okay?
Yes, ma'am, we can.
So you have to be a nonprofit. Okay, so that, I mean, number one criteria is nonprofit, but what caught our eye, and VCU, even though we get this, we're not, you have to be careful, I think, with all the different grants and stuff that we are able to work with, and then what the state already does for our system. But it's, if you look here in the center, this really covers a broad spectrum for everyone that's here that could be interested in this, but it's for those folks that may have severe limited access to medical, dental, mental health. To me, dental is a very underserved population here in our Tri-County area. And then mental health care providers, they're dropping like flies. You know, our provider, we now have 3 psychiatrists that have retired in the past 6 months. We service actively over 600 adults. I've probably got at least 100 plus on the waiting list. And, you know, you really don't want these people on a waiting list more than 30 days. I'm pulling in VCU Richmond and everybody else trying to figure out something to help with that gap. But if you see the infant mortality rate, that's interesting. You know, just low income, high poverty, you know, this for our bread baskets and all different things such as that, you know, maybe our area agency on aging's, but this is where I was going with it, is the high levels of drug abuse. So there's an opportunity if you've got something going on, and just obviously medically vulnerable, whether it's lack of education, self-neglect, you know, many of those things fall into play with different age groups, as you all know. And, you know, it does not have to be a hospital system. It is for other organizations, but again, you do have to be nonprofit. But the winner, it's $100,000. You know, it's a fabulous grant. I just learned about it when I shared it with Keenan. And what I'd like to do is, if Keenan, you know, I'll send her this, because here's your worksheet. if I touch it, I don't know if it's going to let me. Can you guys still see it? Probably won't show up. But anyway, but you have to, it opened on November the 1st. You have to have your information in by January the 6th. So to me, it's a good opportunity. If you can see my Word document opening, do you see that okay? Or do I need to stop and reshare?
It's coming
Yep.
up.
Yep.
Wasn't
So
clear.
here's your worksheet. Again, it's very basic. It's very interesting. I mean, you know, with any type of grant, you know, there's a lot of information. But anyway, we just think it's a good opportunity for our community, some of you guys and the groups that you're with, is to, you know, to utilize this hopefully and see what happens. But Keenan and I will work on that piece because I did not drill down. Like I said, I had an unexpected sick child pop up. So I haven't drilled that piece down about a medical director, I think is what you were asking me about.
Yeah, it said, I read through it when you first sent it to me, and it said that as a coalition, we would have to have, as a group applying for the grant, we would have to have a connection to a hospital providing services. So that's the only thing. In fact, having written grants before and working on grants currently, just thinking about some of that MOAs or partnership agreements, that we would have to do that. But what I'll do is I'll send that link out to everybody as part of the minutes today. And if we wanted to have a conversation as a leadership team and other members to get together and talk about ways we could partner on that grant, I certainly could block the time to do that grant application prior to January 6th. We do have time for it.
Okay, great.
All right, that's awesome, awesome, awesome. All right, so with that being said, that's the end of the business agenda I had for this morning. Does anyone else have an item they would like to bring up?
Crickets, yeah, exactly.
Crickets? I just want to make sure.
Great minds think alike.
All right, questions, concerns? All right.
Did we have anybody in the meeting that felt like they might be free to attend CACA? Is there anybody interested?
I might be.
Right. Christy, Catherine?
Yeah, I let Keenan know that, you know, we were interested last year, but VCU kind of nixed us traveling, but this year they've opened it up for us a little bit more.
Same here. We
That would be
yeah.
good.
started back traveling again.
Awesome, awesome, all right.
Yeah, they needed all hands on deck last year with everything we went through, so.
Yeah, well, I'm just glad to see there's interest. It's an important conference.
Okay.
And I'm interested, but I feel like there are people who haven't had the opportunity to go yet, and I don't want to take a slot from somebody who hasn't been, so.
And you had a phenomenal time last year too, Mary. I apologize I didn't bring up that you went last year as well.
Yes, it was wonderful.
All right, awesome, awesome. All right. Oh, and also, by the way, I am looking into, but I haven't got information back yet, about sending some of our folks to the virtual Creating Trauma Sensitive Schools Conference as part of the TICKN. Last year, we funded 218 people from our area to go to that virtual conference. This year, I'm reaching out to see what we can do to support that again this year. So I know that was quite popular in the TICKN group and quite popular among the teachers in our local school system.
Yeah, I'd like to see that for some of our Head Start folks if they
Yes.
didn't attend it last year. So make sure you throw me in on that so
Okay.
that I can forward it.
Absolutely.
And I've asked Denise Smith from our staff to possibly play a part in the TICKN. She's our trauma informed specialist at the agency, and she works with all the kids. So
Okay. All right. I'm looping you in with the meeting on Monday. So then what you could do is forward that to her and then I'll
that works for
follow
me.
back up with her.
Sure thing.
Awesome. And so your thoughts, I was thinking on the virtual Creating Trauma Sensitive Schools Conference, I was going to request funds to send 10 to 15. Does that sound reasonable? Mary, does that sound reasonable to you?
Say that one more time.
Send folks to the virtual, the Creating Trauma Sensitive Schools Conference this year is virtual options for folks to attend as it was last year. And I was pushed forward a proposal for 10 to 15 folks affiliated with the Ticken and Coalition to attend that. And that's in February. That's in late February.
I think so. Yeah, I do.
All right, fantastic. All right, and if anyone on here currently does not follow our newsletter, social media, or Instagram, I will be adding you automatically this afternoon to our newsletter outreach. When you receive the newsletter that comes out again in December and you do not want to subscribe to it, there is a button there that says unsubscribe. And then I'll also be emailing you the links to follow our social media, Facebook and Instagram. I can't automatically put you on there, but I can send you a link so you can follow it.
So do you have emails on all the people on?
Yeah, through their
Great,
registration.
okay. Awesome.
Yes, absolutely. All right, if there are no other questions, we appreciate your time this morning. Again, we hope to see everybody again on December 15th. Again, Tamika Tony from McGuire Veterans Administration is going to be joining us on December 15th as our guest speaker to talk about veteran suicide prevention in the Southside area. I hope all you all will join and you will tell innumerable folks, neighbors, colleagues about the opportunity again to hear her speak about her efforts as she's pushing our way. I'm happy that she reached out to our organization, Southside Wellness Coalition, to be the first stop for her and talks about what we can do to support our local veterans in our community. All right. Goodbye, everybody.
See you later,
Thank
everybody.
you.
Take care.
Thanks for attending.
Bye. Yes.
Okay.
Oops, no, I gotta.
Good. Here I'm looking for my